All righty, so we're recording. Again, thank you all. And Dr. Ford, if you would like to start us off and take it away, you are more than welcome to begin.
Are we able to share screen? Is that all right?
Mm-hmm. All right, I've made you a co-host. Hopefully that should work.
Thank you.
Yes.
We're all experts at Zoom by now, right? Is that how this works? Hi to a couple of my colleagues out there. Hey, hopefully you can see my screen. It says BroncoFit, right? And up top right is a interesting picture of a brain, right? That has unfortunately been damaged, probably from repeated concussions. Some of you are familiar with CTE. So that is actually a picture from Boston University's research. So I was asked to just talk about some concussion signs and symptoms and so forth. Does that sound right to those that are joining us? And then, so a couple, and then I added a slide of some do's and don'ts related to concussion, and then added some resources that I often use, and that for the students that I work with in athletic training, some of those resources we use to kind of discuss a little bit more concussions. Does that sound, Hannah, sound okay? Sound good?
Hey, Phil, this is Shelley.
Yep.
We're seeing your presenter view.
Thank you.
Your notes and stuff.
How about that?
Good.
Is that better?
Yes.
Thank you, Dr. Lucas. When you got two screens like that, I'm like, which one are they seeing? So yes. Real quick, anybody know what that, back to this Bronco head, where that's at? Anybody have an idea? I bet you Stephanie does. Anyways, that's in the Bronco, the football complex. I like that big glass mural in the front by all the uniforms. Anyways, so, all right. So for those, maybe my generation, we used to talk about, I got my bell rung. I remember my first concussion in high school football. It was a doozy. But I had several other things that the coaches said, oh, you just got your bell rung, you're okay, keep going, right? And that, thankfully, I think has changed. Unfortunately, the one concussion I had, I was sitting in the shower, kind of up against the wall with my feet tucked to my chest, going, where am I, what am I doing, and why am I here? But we used to call it a bell rung. So I think that's the thing that we now call a concussion, right? Or even some experts would say it's a mild traumatic brain injury. So I wanted people to, that we've moved off, thank goodness, the bell rung thing, to maybe more understanding, at least in this generation, about head injuries and such. So I'm throwing that out there. And then I've got resources here, and that's a lot, so I can share this with anybody that wants it later on. But I pulled some things from what's called the SCAT-5 on concussion, and then I pulled some things from some other resources from the National Athletic Trainers Association. But there's other great resources. Anybody that is concerned with emergent care related issues like a potential concussion, but the Corey Stringer Institute is phenomenal location for evidence-based information, from heat illness to concussion, brain injury, so forth and so on. And real briefly, Corey Stringer was an NFL lineman that suffered a massive heat stroke in 1999, unfortunately succumbed to multiple organ failures as a result of that heat stroke with the Minnesota Vikings. And as a result, his wife worked with the University of Connecticut to form the Corey Stringer Institute. And so they deal with a lot of emergent care things. And again, it's a good resource for all kinds of emergency kind of things related to athletics. There's others here. We don't necessarily have to get into all of those, but I think I added these back to the end as well. So there's so much out there on concussion that certainly can be overwhelming, to say the least. So on the SCAT-5, if those that aren't familiar with it, this is an assessment tool that we can use. The one thing great about concussion and where we're at in our understanding now is we're doing a vigilant job, I would say, in creating some baseline testing. Instead of reactionary to a concussion and trying to figure out the severity and your signs and symptoms, now we're doing a really good job of trying to figure out the status quo before injury happens. And so the SCAT-5 is a pretty significant assessment tool that kind of covers the large swath of information. So anybody here that is an active, physically active individual, right, maybe doing some aspects of this assessment tool could be valuable for you if you do end up sustaining a concussion. And so one of those key areas that you see on your screen here is kind of what they call the symptom checklist, right? And it goes through all the possible symptoms that could be related to a concussion. And you could score yourself. So I've taken my 12-year-old son through the most of the SCAT-5. Some of it's appropriate, and they've also come out with a SCAT-5 for pediatrics. So it's age specific, usually for 12 and under, or under 12, I should say. But you could score your symptoms now, and hopefully we're all feeling pretty good today, and we don't have any recent trauma to our brain, and our symptoms should all be a 0 on this symptom checklist. But it's a great list to kind of tell us what could be associated with a head injury. And as of a lot of you know, signs and symptoms cross over all kinds of pathology, right? Some of this could be related to heat illness because I'm dizzy or I feel faint, or so really kind of teasing out some of those specifics. So I just pulled out some, and we'll like to highlight some of those common signs and symptoms. Like headache's the big one. I put it first on our list, and it's the first on the symptom checklist. It's really commonly reported. I don't have the stats with me, but we use headache a lot for symptom resolution, right? So as we maybe sustained a head injury and I've developed a headache, maybe when the headache finally goes away and we say we're asymptomatic, maybe that's a cue for us to possibly return to some level of physical activity, or maybe back to the sport that we were talking about. The other thing they often warn us too with headaches, it may not show up for a while. So it might be several hours later, 24 hours later. Sometimes it just kind of lingers there a little bit. Certainly there are different types of headaches. Not necessarily going to get into specifics of those, but headache is a big part of maybe a post-concussion symptom that we see often in individuals. Before I move on, I also want to say in today's concussion understanding is it really only takes one sign or symptom to be then diagnosed with a concussion. So years ago, we used to grade them, right? A 1, 2, and 3, and 3 is really bad, and 1's kind of good. We rarely do that now. We're very symptom specific and trying to chart those symptoms across time. We may grade concussions kind of on the diagnostic end. Maybe the physician or provider will actually end up putting in the notes as a particular grade, but we tend to avoid that grading right now and go more on symptom evaluation. So dizziness obviously is really common. That's tough too, because that crosses over my seasonal allergies, right? So we got to put this in context. Maybe I bumped my head out there playing soccer, right? That's That's what my son does. I don't do too much of that. I mountain bike, so I bumped my head quite a few times doing that. We certainly see balance issues, right? That's something really commonly assessed, whether it's baseline, right, before a head injury may happen. The SCAT-5 does a basic balance assessment, like standing on one leg. So balance changes are certainly a part of this. Feeling foggy. Some people maybe say, I feel dizzy, right? They might lump those together. Maybe they just feel off. And again, now you're starting to see a collection of things. We start to see more than one of these, certainly tie that to a mechanism injury. Vision changes, that gets a little unnerving, scary. I've had that personally. It was a mountain bike accident, and in the part of that, I got tunnel vision. So some of it's seeing blurry vision, some of it's seeing double, some of it's tunnel vision, but certainly any vision changes would certainly alert us to a potential pretty significant. I hear athletes that I've cared for a lot get kind of sick to the stomach, so they are nauseated after that injury. Seems to be something that's common as maybe the severity goes up a little bit. We often attach vomiting to that too, but again, vomiting can be attached to heat illnesses. So I often talk to students like we've got to, again, tease out what's the mechanism, what environment are they in. Those sound pretty familiar, right? And then the other one, especially post-concussion, and this often lingers for some, is they don't like bright lights. Driving at night with lights blaring at them, loud noises certainly can be another sign of symptoms. And sometimes this is a little bit more on the subtle side. So keep me on my time. So certainly hitting some of the highlights. In a lot of concussion protocols, as we hear out there, they'll measure some reaction times, either baseline or after a suspected head injury. Boise State, we often have done technology on the sidelines or in the athletic training facilities where we're looking at kind of almost looks like a video game, right? We're looking at reaction time through that technology. And so we can kind of compare that and see how that individual is doing with that. So that one's requires some assessment and maybe doesn't fit everybody's experience with concussion. Maybe they don't have access to that. Concentration problems, we certainly hear quite a bit recorded, especially lingering. We're kind of changing the term post-concussion symptoms, but that's kind of what I'm referring to. Sometimes concentration problems linger. I certainly have had athletes through my almost 30 years as an athletic trainer, months out, still having problems like in classroom with cognitive concentration efforts that like during testing, long periods of testing, night classes are always the problem. They're 2 or 3 hours long, you're sitting stationary. So we kind of see these subtle things kind of become something that's impacting like that student athlete's normal life. Confusion kind of goes with the foggy and dizzy. So not this last one, but this is something maybe Stephanie will talk about a little bit, but man, the athletes that I've dealt with and some of the concussions that stick in my mind through that 3 decades have been really centered on emotional changes. They are acting out of character for them. And that's one thing I love about my profession as an athletic trainer is I usually get to know their disposition, their personalities. And when that's different post head injury mechanism, it really kind of raises a big flag for me. I had one, this is a long time ago, but really go ballistic. It took 3 or 4 people to kind of contain this athlete's violent reaction to what's going on. He was throwing people off of him. We wanted to spine board him with EMS. It got really violent. And that's a really obvious behavioral change, but some of these are emotional changes. Some of them are really subtle. I always tell students it goes from anger to apathy, right? Somewhere in between there is just not normal. You can't always predict that. That's a big kind of lens into maybe what's going on. Some amnesia we talk about, but maybe there's subtle remembering problems. I put that term up there. Sleep changes for some athletes, post-concussion mechanism. They certainly may have some problems there. Fatigue, low energy. So certainly covered a lot of them. Again, it only takes a few to kind of put us into a diagnosis of a concussion, and certainly they can run a pretty wide swath. Is there any questions? I think that was my last little cloud in this rainy day scenario that's kind of showing up. Again, the SCAT5, you can look it up in one of the links, but you could, I would encourage students, BroncoFit students, to do the symptom checklist when they feel normal, right? Fill this out. And if they ever find themselves in a situation where they may feel like they've got a concussion, they could go back and answer those questions again to kind of create their own evaluation. Certainly, we would recommend you receiving medical evaluation if you think you've received a concussion. But and these, again, are things that I do with my own son. He's gone through all of this. And then some of you, and it's a reference that I have here, gone maybe impact testing. So hopefully we can refer to St. Luke's. My son's done impact testing just a month ago for his baseline testing for his soccer season. And it's really good because now he can do it at home on his computer. He can log in and kind of check the neurocognitive processing they go through. And that gives him a baseline. And if he sustains a concussion, we can go right back to that data, retake that test, and kind of see where he's at if that situation arises. So I've got some do's and don'ts. I hope I'm not stepping on anybody else's toes with, I thought that's what I was charged with a little bit. So this particular picture comes from the National Athletic Trainers Association infographic on concussion. I've cut some of it out, but I've pulled from all kinds of places some do's and don'ts. I just went through some additional concussion training about 3 or 4 weeks ago, and the emphasis was rehabilitation post-concussion. And I won't spend a lot of time on that, but we're starting to, again, evolve on how we deal with these post-concussion efforts. So certainly get checked out. St. Luke's Concussion Clinic should be a resource that at least student athletes or intramural club sports players at Boise State, or any physically active person, if they're getting a sports related concussion, I certainly would recommend the St. Luke's Concussion Clinics. Go get checked out. Use an athletic trainer if that's part of club sports at Boise State. Report your symptoms. We see that now. Years ago, we'd suppress them, we'd hide them. I wouldn't tell anybody about them. And now we're seeing better reporting. And I'm encouraging BroncoFit students, tell a friend. Like, wow, I just don't feel normal. And I played Frisbee the other day, ultimate Frisbee, and I got, dinked in the head, and I didn't even think about it. But now I got this headache. Tell a friend at least, because we're in a area of supporting each other. So I like that little tag. You hear throughout, don't return the same day to that sport. So I want to reinforce that. That's usually in our concussion laws in the state of Idaho. Even at the secondary level, they won't allow you, or you shouldn't be returning to that sport that day. And reminding, it's a good rule to not return to those level of activities until you're symptom free. Now, that doesn't mean you're not engaging in a progression of exercise and activity up to that point. Certainly, Boise State's athletics concussion protocol has phases, but that's a good kind of rule of thumb. Take it easy at first, but this latest research was saying engage in aerobic activity to start. get physically active again, but just don't put yourself in a vulnerable situation to get a second injury. So even if you got this little lingering headache, maybe the recommendations, you seem to recover better if you just jumped on a stationary bike for a few minutes. We're starting to see a lot of benefits of that, and that's kind of encouraging. Years ago, we'd stuff you in a dark room in your bedroom, lock the door, and say, hey, when your headache gone, you can come out of the cave, right? And that's not the case anymore. Hopefully I'm doing good on time. They say get rest. Years ago, we're like, check them every 5 minutes, make sure they're okay. Get rest, get sleep. That's good. Recovery is part of that process. Again, don't spend too much time in the sitting in class for 3 hours. That's really rough. Taking a 2-hour midterm, that's really, really rough. That often it exacerbates symptoms. Athletes in my end get really irritated. They have emotional changes when they've got to then focus for so long, and that ties into another don't. The other thing is, hey, nutrition is a big help. So I just said eat and drink healthy stuff. That's a big part of recovery from anything. So I think that's a good thing to think about. My son, this would be apropos. Hey, get off the Xbox for a little bit, right? That focus, gaming, electronics, search in a lot of individuals seems to exacerbate symptoms. And then I want to encourage people to get baseline testing, do something along those lines, especially if you're participating in some type of competitive sports where you could get impact testing. You could do it on your home computer, and if something happens, you can use that information to do that. And I think it cost my son, or it cost us $15 to have that done, right? To do that neurocognitive test. So I think I did pretty good time-wise. I don't know if anybody out there, other than my colleagues, which I see out there, have some questions, at least for me, because I got to run to another meeting in 5 minutes. So thank you for letting me go first, I guess.
Yeah, thank you so much, Dr. Ford. I don't see any questions in the chat, but anyone is free to unmute themselves and ask away. If there are no questions, then you can go ahead and get to your meeting. I want to be mindful of your time. We really appreciate you coming today and speaking with us a little bit.
Yeah, if you want to do it again, let me know. Sounds great.
Yeah. And now, Stephanie Donaldson, if you would like to take it away, I can go ahead and put the handout in the chat. Let me make you a co-host.
Oh, I think I am.
You are? Okay, good.
Let me try this out. Okay. Is it working?
Yeah,
Okay.
looks great.
Sweet. Okay. Thank you so much for inviting me to take part in this. My name is Stephanie Donaldson, and I work in the athletic department as the director of performance psychology and athletic counseling. And today, I am hoping to cover really, honestly, what the latest research and consensus statements highlight, and that's the role of psychological factors and how they play into concussion symptom management and recovery. So it's really, I look at it as this multifaceted approach, and it's really identifying the cognitive, the emotional, the behavioral symptoms of concussions. We'll also talk about the predisposing risk factors, and then really define the, again, that multidisciplinary approach, and then hopefully get into the role of the licensed mental health clinician in sports-related concussion management. So typically concussions, and I don't know if this is super small, I also emailed this handout to Hannah if she could share in the group chat, because I know it's really small, but typically concussions, concussion events, we've talked about, produce this physical, cognitive, emotional, neurobehavioral symptoms, right, that are generally most severe in that acute post-injury timeframe of 1 to 2 days. And then we see this reduction in resolution over the subsequent days and weeks. So kind of the recent guidelines indicate that most sports-related concussions, we're seeing resolution over days and weeks. And it seems like most within 3 weeks, with that 7 to 10 days being the most referenced time frame. Why I bring this up is because when I'm talking about these signs and symptoms, I'm talking about it as this subset of sports-related concussions where patients may not resolve in that expected time frame. And this is where post-concussion syndrome that you've heard about comes into play. So a lot of studies have been done on the injury rehabilitation, and a lot of it is done, and the models that are used are on musculoskeletal injuries and not necessarily sports-related concussions. So the model's shown, it really does lend itself to sports-related concussion and the rehabilitation management that occurs. As you can see in the diagram, the stress at the top is that sports injury, which in this case is concussions. And there are certain pre-injury factors that we look at and that we also need to measure, as Dr. Ford talked about, to establish that baseline. So when we can better, when we can look at these psychological risk factors before concussions and we can establish that baseline, I think we can better appraise how a student athlete is going to respond in this sports-related concussion. So the risk factors and things that we look at are both personal and situational. Some of the risk factors include ADHD, other brain-related disabilities, history of life event stressors, post-traumatic stress disorder, a history of mental health conditions such as anxiety or depression, coping styles, their coping resources, what they currently have, social supports. We also look at their personality, baseline and then after, existing concussion education, what their exposure to concussion education has been, and the characteristics of the injury itself, and the cognitive appraisals that they have of that injury. For instance, someone could be really upset that I got this injury and I'm out now and it happened at practice. It didn't even happen in a game. It happened at practice and I'm really upset by that. And so we also look at the sport itself. We look at sleep disturbances, age, history of having sustained one or more concussions, because we know that the data shows us that the increased risk of sustaining multiple concussions thereafter. So these are some of the things that we look at. So with all of these risk factors, and you're looking at the neurobiological, the psychogenic, the pathophysiological causes of sports-related concussions. And when as you can see, the cycle goes down. So when we're looking at those things, and in turn, we're looking at the influence of that cycle and the influence of the cognitive, the affective, the behavioral symptoms, as you can see, the arrows coming down, which in turn really influence the overall psychological outcomes of concussion and how quickly someone is able to move through the protocols. So the next slide, when we look at the mental health symptoms in sports-related concussions, and especially in that post-concussion period that we talked about, that symptoms seem to linger, we talk a lot about symptom clusters. And oftentimes, and Dr. Ford talked about this too, there's this overlap between the symptoms of, say, clinical depression and post-concussion syndromes. And it can be really hard a lot of times to differentiate the two and to pull them out. So I'll talk about it more in depth a bit, but again, it's establishing that baseline measure on student athletes, and that's so important in this process. But with these clusters of symptoms, we see the somatic complaints that I don't need to go over. Dr. Ford went over those, but you see the somatic complaints, you see cognitive impairments that were also gone over as well. The fatigue, the fogginess, and you can understand how those really affect athletic performance. Also problems with memory and concentration, along with issues of sleep following a concussion. So sleep is a really important part of the puzzle. Studies show that student athletes who are sleep deprived are already more likely to sustain sports-related injuries, and concussion being one of them. And this is likely due in part to that slowed reaction time, difficulty making decisions, not being alert, not being rested. And so you make mistakes. Furthermore, disrupted sleep patterns. I mean, some studies indicate that 30 to 70% of the population, their sleep is affected post-concussion. So it's not surprising that we see sleep apnea, we see insomnia, we see this ever-present fatigue. And it's not surprising that they're commonly reported behavioral symptoms for patients who have that post-concussion syndrome. So now looking at the affective or the emotional clusters, we see reports of feeling more emotional, crying for no reason. I don't know why I'm emotional, but I am. Lots of anxiety, worry, fear can be related to concussions. And you can have these things pre-existing. You could have had anxiety pre-existing, and it could be worsened by the concussion itself. Or you can see things like clinical depression and clinical anxiety manifest itself or appear for the first time following a concussion. And so it's also understanding that we oftentimes want to get into the cause and effect, but the cause versus effect and what caused what. But sometimes these things can be pre-existing, being made worse by it, or sometimes they can show up for the first time after a concussion. So suicidal ideation is seen in patients with post-concussion, in the post-concussion period. So I've had student athletes come in while on the concussion protocol and state that they don't feel safe. They're feeling really scared of their thoughts, and they don't know what to do. And I'm thankful that they're able to come in and talk, because in part, the ability to recognize that these thoughts are happening and that they're really scary, the ability to recognize that is done through, again, baseline screening, but also preventative education, which we'll talk about later, so that patients can really recognize and understand when their thoughts are deviating from baseline. So anger, rage, irritability, short fuse, those are symptoms that we see with concussions. And I think that could be a whole topic in and of itself. But based in a really basic explanation, parts of the brain that regulate emotion, that regulate your emotions and regulate your executive functioning, they're affected after concussion. So ultimately, again, it's really hard to determine the cause and effect. Baseline measures are really important and critical. Can't say that enough. And it really, the time of recovery really varies greatly, which can be really frustrating for these athletes. And the return to play process can be vague and doesn't seem, you can make advances and then move back. And so there's a lot that you can see. Gosh, like looking at those lists, I could see how this really affects mental health. So at Boise State, we have a multidisciplinary treatment team. So I'm the mental health clinician on this team. It's a holistic model where we pull in different providers and, as you see, athletic trainer, team physician, sports performance, sports dietitian, myself, and then especially in concussion management, we'll pull in the academic advisors. So what does baseline and concussion assessment look like when you're talking about the mental health components of concussion? So again, it's really important to screen student athletes throughout the year to develop that baseline, which I like to call a yardstick. So you can kind of measure before and after, and you can compare those and identify changes in functioning. So some of the screenings that were mentioned is GAT5, but the other ones are more specific to mental health, the PHQ-9, the GAD-7. There's different ones that look at anger expression, compulsiveness, because we oftentimes see that impulsivity, and then the basic concussion symptom scales. So in addition to those scales and assessments, we also do, I ask it as part of my mental health intake, I ask about concussion history, I ask about mental health history. I ask about, I have a sleep screening. And then also there are things to consider post-concussion as well. And those are, I'll go over those in a minute, but some of the questions that I really look at, again, are the history of concussions. I want to know specific numbers. I want to know behavioral differences that have been noted by family or teammates. I'm really getting a really good idea. And these are questions that I ask is part of my general intake, because then down the line, if a student athlete has a concussion, I already have a good idea of their concussion history and their mental health history. So those are, in addition, some of the questions that can be helpful to ask after concussion. There's the Rivermead post-concussion symptom questionnaire, which has a lot of questions in it, but the mental health symptoms, the questions that I use for it, compare irritability, anger, your emotional states before the concussion, and then after that, it asks you, do you feel significantly more this way? And so it looks at a few of the emotional markers or the mental health markers. So with mental health intervention, intervention is really the best when it's a multidisciplinary approach. So you're coming at it from a variety of angles with a variety of qualified professionals. So the four-pronged approach is the cognitive behavioral therapy, which we'll go over in a minute. And that's done by the licensed mental health clinician who's trained in sports-related concussion protocol and treatment. There's patient education, which I mentioned, which is a critical part of that treatment team approach. You know, knowledge is power. When I better understand what's happening to my body, I'm better able to adhere to the treatment protocols that are in place, such as limiting cognitive activity and the rest, or whatever it may be. I understand why I'm doing it if I'm educated. Also, preventatively, education on concussions, on the signs and symptoms, what to look out for. It really provides this upstream prevention that enables student athletes to reach out, to report, to recognize when something's off. So I think education really is the key to promoting symptom reporting. And like Dr. Ford said, I hope, and I think we are moving towards more student athletes speaking up about their symptoms instead of trying to hide it because they don't want to miss out on playing time, or they're worried about how it might affect their sport or their ability to play again. So education is something that's really disseminated by all of the treatment team. And I've included in the handout that Hannah can maybe send out, that it's a one-pager, might be 2 pages, I guess, 1 page front and back, with examples of education. It's not the one we use, but it's an example of education that you can use for concussion. So the next one, relaxation strategies, ways obviously to reduce anxiety, to reduce worry. Relaxation strategies and mental skills have really been highlighted as effective interventions to reduce the incidence and duration of symptoms during a concussion and during the concussion protocol. And these are most often initiated by the mental health clinician, but then they're reinforced and implemented during rehabilitation sessions with the athletic trainers. So lastly, sleep monitoring. We mentioned how important sleep is and how much it is affected by concussions. So monitoring sleep is important. And again, if you can develop baseline measures for before concussions, some programs have student athletes wear those wearable sleep monitors that are looking and they're tracking sleep disturbances, the quality and the quantity, both before and after concussion. So it should be noted though, that none of these interventions are being suggested as standalone interventions or approaches. Instead, it's really this multi-pronged approach to mental health concussion management. So the cognitive behavioral part, cognitive behavioral therapy is one of the most effective gold standard. It's really well researched treatment interventions, and it's found to be really effective with people who present with that post-concussion lingering symptoms. And it's particularly effective when it started as soon as possible. So CBT really aims to harness and address those maladaptive thinking patterns that happen, and then also the catastrophizing, the blowing things up, the faulty ways of thinking that can happen after a concussion, and that can really enable the student athlete. Those things happen, which can really impose a lot of cognitive and physical limitations on the student athlete. And so if we're able to work through those thinking patterns, that catastrophic way of thinking, we're better able to help them feel like they can successfully manage all of the things that are being thrown at them. So CBC is really, again, it's a clinically backed treatment. It's really shown to be effective in the treatment of anxiety, depression, and again, those related sleep disruptions that you see in that concussions. So CBT also addresses the connection between, what I like about it is it addresses the lack of behavioral and emotional coping strategies with the higher levels of negative cognitive and affective states, like with depression and fear and sleep. So when you have a lack of coping strategies, and then you also have the presence of depression, fear, sleep, cognitive disturbances, it can really prolong that recovery. And so CBT also helps you find better ways of coping with all the things that are going on. CBT, again, is really helpful for disrupting that neurofeedback loop that can happen, that when your brain just goes around and around, and it can help kind of create a exit plan out of it, and can help you create a new way of thinking, a new neurofeedback loop. So another thing I really like about it is that it addresses the hypervigilance that I see a lot of times with student athletes. In part of the concussion protocol is being hypervigilant of reporting your symptoms or any new symptoms that might appear, or any symptoms that change. And there becomes this hypervigilance of somatic symptoms and reporting them. And so a lot of times that also comes with an increase in anxiety and fear about the somatic symptoms. So CBT is great for addressing that. Again, it's great for sleep disturbances. And I just want to note that the CBT is done by the licensed clinician on the treatment team, the licensed mental health clinician on the treatment team. So that's all I had. That was a lot of information really quickly, and hopefully I've given you kind of an overview or a quick dive of some of the signs and symptoms related to sports related concussions, and give you a kind of a brief idea of what that process looked like. So thank you.
Thank you so much. I went ahead and put that handout in the chat a couple of times throughout the presentation. If anybody has any trouble opening that, please let me know. But thank you so much for that valuable information. All righty, last but not least, Dr. Lucas, I want to go ahead and take it away. I'm going to make you a co-host if you would like to share your screen.
Thank you. Hannah, are we done at 2:30?
Yeah, or if you want to go a little bit over, say, about an hour, there's some wiggle room there if you keep going over.
Okay. Well, first I wanted to thank Hannah for inviting me to share some of the work that I've done from my disciplinary perspective. I'm in the Department of Kinesiology also. So I'm going to talk about how concussions, let's do this, are not just a health issue, they're also a sociocultural issue. I come out of sports sociology. So as I'm going to refer a lot to sports sociologist Matt Ventresca, who is the first person I read who really drew attention to looking at concussions in this way, or this aspect of concussions. He writes about how the media frames sport-related concussions as a science problem, as technology, new helmets, new ways of scanning the brain or measuring impact and things like that. And the media was not also considering concussions as a social problem. So we know in our society and in many societies that sport is a significant social institution. It tells us things about, what it means to be a man or a woman, how hard work can overcome long odds. It can be nationalistic or related to our connection to community. So from this perspective, better science, improved technology, those things don't address some of the issues that I'm going to talk about today that are related and connected to concussions. So some of the sociocultural factors include the culture of sport, and I'm going to focus a lot on the pain principle and tell you what that's all about. Some aspects of social identity and relationships, whether that's gender, class, race, ethnicity, sexuality, athlete identity, and your relationships within sport. And I am focusing on sport because that's what I know about. Some of these things will also relate to concussions that are incurred in other domains. And then we're going to end by talking about the role of media representations also. You're going to see there's connections between some of these factors, very much interconnected, just like life. So the culture of sport. One aspect of sport culture that scholars frequently reference with regard to pain and injury, and not just concussions, but other forms of pain and injury, is what's known as the pain principle. And this term was coined by Don Sabo almost 20 years ago. He's a well-respected sports sociologist, and many, many other researchers since then have used this concept when they're exploring pain and injury, and also specifically concussions. So the pain principle, these are Sabo's words, is defined as a patriarchal cultural belief that pain is inevitable and that the endurance of pain enhances one's character and moral worth. Pain is regarded as more important than pleasure, and sacrifice is presumed to be required to establish self-worth, social acceptance, and social gains. So the pain principle helps explain many of the troubling aspects of concussions, both in and out of sport, such as helping to illustrate the challenges that many of us have with getting athletes to self-report potential concussions, as well as other injuries, as also related to the responses that coaches, officials, parents, journalists, and athletes themselves have to concussions. Gender stereotypes and assumptions about what it means to be a man or an athlete, coupled with the hidden injury aspect of concussions, create a recipe for potentially poor outcomes for both male and female athletes. Even though this is referring to a patriarchal cultural belief, it has wide implications for men and women in sport. So I'm going to share some key findings from just one study, a 2019 study that reflects the value and place of high-level sport in U.S. culture. So another, continuing to talk about the culture of sport. And the authors in this study interviewed 93 collegiate athletes and also athletic trainers from 11 large universities. And they were trying to document narratives, which is kind of a fancy scholarly word for stories, about sport and sport participation that would help athletes, coaches, and athletic trainers understand why athletes don't want to disclose when they've had a severe head impact. So the researchers, in addition to interviewing athletes and athletic trainers, they also looked at sport films, media coverage and popular media sources about concussions, and also research. And so the 5 themes that they came up with, the 5 types of stories, were play through pain, say that fast 5 times, which I'm sure you have a sense of, you're sacrificing for the team, you ignore pain until you're unable to perform. It's a sign of weakness. the big leagues, and again, we're talking about high level sport. And some of these could relate to even high school sport or club sport, where people don't want to risk having less playing time. They don't want to miss those opportunities to be seen by scouts or the coach. They don't want to jeopardize their ability to play up the next level. At the highest level, they want to be able to provide for their family through playing professional sports. Commodification refers to the fact that many athletes have traded their bodies, their bodily resource for gain, whether that's a scholarship, prestige, potential to play professionally. So they feel like their body is their only thing that's of value to the team or the organization. So they don't want to risk that. The masculine warrior theme was widespread with both male and female athletes in the study. I'm embodying heroic traits through my performance. Violence, bravery, and sacrifice demonstrate my athletic prowess. Reporting is a sign of weakness. I should be able to take the pain, don't want to look like a wimp. In contrast, they also found that there were some athletes willing to disclose their symptoms, and they called this theme the need for safety. And these were people who valued their health and well-being. And so that was important to them to report. I'll just refer briefly to another study that also looked at athletes' experiences about not reporting. This is a big area of study. Why aren't athletes reporting these symptoms? And conformance to sport, cultural norms, whether that was the pain principle or team allegiance, were two big factors in another study with hundreds of athletes. And there's many more studies that have looked at that. So social identity is another sociocultural factor that comes into play here. And there's various forms of social identity that can interplay with the culture of sport. So we've talked about gender, and again, these things connect. Masculinity is equated with being tough, immune to pain, playing through pain, toughing it out, men don't cry. And the pain principle, as we've talked about, incorporates these ideas about this type of masculinity. When I teach about this, I have students watch a public service announcement from the NFL Players Association. This is from 2017, and their PSA is entitled "Be Man Enough to Admit When You're Hurt." So there's several football players, professional athletes who talk about their experience with concussions and pressure to respond in a certain way when they've been concussed. And so this PSA is trying to flip the script on what it means to be a man. You will report when you're hurt. Researchers have spent a lot of time in various forms looking at gender differences in concussion reporting and also in incidence rates. And there's lots of hypotheses out there about those differences. Some of it's based on the science of the brain or the body, and some of it's on sociocultural factors. So what is known is that there's very little research on women's concussions in sport compared to research on men's concussion in sport. That's starting to shift and change. But when there's not much known about concussions on women, there's not as much reported in the media. There's a concern that concussion awareness might not be as high in some of the sports that women dominate in or predominantly play. There's also stereotypes about gender suggesting that men are tougher than women or girls, which may lead coaches and trainers to take injuries more seriously for girls and women, because they may be more concerned that they're hurt than they would be for males. But many women athletes, like many male athletes, don't want to be perceived as weak or vulnerable or hysterical. And that's kind of a historical term. But those are labels that have been and are sometimes still attached to women in society and also women in sport. So they are less likely in many cases to report on concussion symptoms as well. For those reasons, they don't want to be seen in that way. Matt Van Treska raised a lot of questions about the role of socioeconomic status that might come into play when you consider who may be more likely to report brain injuries. So, what's at stake if you report a possible concussion? Could you lose your starting position? Would that influence college prospects? Who is more likely to quit a sport due to concerns about brain injuries, perhaps because they know they have other career opportunities available. What about access to healthcare and medical knowledge about brain injuries? And who is more likely to play violent sports to begin with? This can be related to opportunities, perceived opportunities for success. And this is where race, ethnicity can be connected with class, along with the legacy of racism in our country related to opportunities, education, and sport. In terms of sexual identity, the idea gets to this conflation that real men play sports, real men are heterosexual. If I report my pain or my concussion, that brings my masculinity into question, which may then bring my sexuality into question. So there's a concern that men might be quiet because of that. And the last one on athletic identity, which is a psychological term, but we're going to talk about it in terms of sociocultural, just given the value that the sport identity has in our culture. In my class, I have students watch a documentary called the CTE Diaries, the life and death of a high school football player killed by concussions. And this is a film about Zach Easter. He committed suicide several years after graduating from a small town high school. And he kept some diaries after he finished, and he talked a lot about his identity as a football player, his experiences with concussions, and the long-term symptoms, anxiety, depression, and headaches. In high school, he gained a reputation from his coach and classmates from being what he called a tough-nosed kid and a hard hitter. And he was proud of his social identity and didn't want to tell anyone about his headaches that he was having after games and practices. So as we know, athletes, particularly male athletes who play football is very highly valued in American society, and admitting, your pain or your concussion symptoms can put that status or that identity in jeopardy. So another, and I'm getting close, almost done, a little bit past 2:30. Another sociocultural factor that researchers have explored is media representations of concussions. And there's been numerous studies that look at specific incidents or individuals or sports like the NFL or hockey or soccer, women's soccer, men's soccer, rugby. The Concussion Legacy Foundation, their media project offers 22 dues for covering concussions in order to help broadcasters and journalists cover concussions the right way, because they recognize that a lot of people get their information, attitudes, tone about concussions through how sport is presented, televised sport, and writing about sport and things like that. So I just pulled out a couple of examples. Don't use colloquial terms and phrases such as ding, bell ringer, shaking off the cobwebs. I don't think we hear that as much anymore, but maybe listen and see if you hear that. Instead, use concussion, brain injury, or traumatic brain injury. Don't assume there was no concussion if there was not a direct blow to the head. And as if you know anything about concussions, that is such a common misconception. Well, there was not a direct blow to the head, or they didn't lose consciousness, so that must not be a concussion. And the science has shown us that concussions don't require a direct blow to the head, but do know a concussion is caused by a force to the brain, which can come from whiplash type movements or impacts to the body. So hopefully you've recognized that there have been changes in media representations over, say, the last 10 years. But just a year ago in October, Fox Sport was called out by Chris Nowinski, who is the co-founder of the Concussion Legacy Foundation. He called them out on an inappropriate ad that they had for Fox Sports on NFL, or NFL on Fox Sports, whatever. And he tweeted out, "Who approved this? Countless former NFL players' lives are being destroyed by CTE, and you thought a skit about giving yourself a brain injury to forget that your team sucks was funny? What's wrong with you?" So I would say if you like to watch sports or read about sports, try and notice, pay attention, how are concussions being talked about, and hopefully the positive changes that have been reported on will continue. So this is it, last slide. So basically, to reiterate, concussions are multifaceted. There's lots of things that need to happen to help make this injury less common and less serious, less harmful to people. And so addressing sociocultural factors that are underlying concussions require changing the culture of sport and reimagining the value of health versus the valor associated with pain. And of course, many, many other things. Okay, that's it.
Thank you so much, Dr. Lucas. It's very interesting.
You're welcome.
Thank you all so much for taking the time to attend this year's concussion seminar. And a special thank you to all the amazing speakers. We really appreciate you taking time out of your day to come and speak with us. So thank you again so much. And we have a few minutes for a small Q&A. So if anyone has any questions, feel free to unmute yourself or leave it in the chat.
Hi, I'm just gonna speak up. This is Joanna. I'm an instructor. So is there like best practices or some sort of guidance for faculty when a student reports a concussion?
Joanna, I don't have an answer for you, but I have done work with the Concussion Clinic, St. Luke's, and that is something that they have seen as a need for how to help faculty get better educated or have better resources to know how to respond when a student comes, if a student even reveals that they've had a concussion. So I recognize the problem. I
haven't had, I teach exclusively online right now. And so I have had a few students who reached out to me and say they're in concussion protocols, and they've actually given me guidance, but it would be nice if I had my own, how do I help them be successful both in their recovery and in the course. So I would, I do see that as a need, and I would be interested in a work group helping with that if something like that were to come.
For a while, Joanna, the EAC, the Equitable Access Center, I'm probably not saying that right. I can't remember. They've changed their name since I started working here. So I just call them the EAC.
Yeah.
For a while, they had someone from the social work department who was going to be specifically on call to assist with concussion or concussed students, and so that would tie in with faculty. So I would say your first step would be to contact EAC and say, I have this student, what guidance can you give me? Because that's, it's a temporary disability and accommodation that the student needs, and that's what the EAC is helpful with. So I'd say that's.
Would it be helpful to recommend that the student reach out to them? Because I've had students who have an injury, and then the EAC steps in on their behalf to say they need extra time because they have a shoulder injury, which makes typing difficult, and yada yada. And so
yes, I think so.
Okay.
I've had meetings with Christy Pardue from the Concussion Clinic and the EAC folks. It was a while ago, but it certainly wouldn't hurt to encourage the student to seek out that support, and then have that documented, and then that helps get information to all the other professors as well. Because the challenge that we've seen, and from some work I've done also with high school students with post-concussion syndrome, is the student's brain is injured, right? So they're not doing their best thinking about how to work through these challenges and problems either. So, at the high school level, they have different kinds of legal accommodations, and I don't know what happens when you go to college because I haven't focused on that. But Stephanie, do you have some insight on how you help the athletes deal with their academic challenges?
And that's where I was thinking, I don't know. Can you guys even see me? I lost the screen, but yeah, I was thinking that I could connect you with the academic services because I know that they take care of that. I just know that there are certain protocols in place, like it's been an issue with screen time, for instance, if someone can't be on a backlit device, but their class is online. And so there's different steps within the protocol that they're working through. So even just sharing the protocol, but I can.
I took a quick look through my emails during this and to see what has come through my email, because like I said, I haven't had many, so I sort of refresh myself as to how I've been notified and things like that. None of it has ever been official. It's always been the student reached out to me and told me what they needed. And so I've been trying to educate myself, because even though it doesn't happen often, or at least it's not reported to me often, I would like to have more tools in my toolkit to help students in however I can help them.
I can take I wrote down, I'm assuming it's the Boise State email.
Yeah.
Okay.
First name, last name at boisestate.edu.
Okay. Yeah, I can connect you with people who might know the answer better than I.
That would be amazing.
Okay.
I don't have anything anybody right now, but it would be nice to know what to do and who to contact to find out what to do, that sort of thing.
Sure, absolutely.
Anybody have any more questions?
I had a question if you have time for one more. I had a question for Stephanie, actually. What does your role, I am a student in the MAT program right now, so I was just wondering what kind of your relationship with the rest of like the sports medicine team looks like when dealing with an athlete with a concussion.
And that's it's that sports performance health and wellness model. So it's it is that collaborative model of care where I work most of I would say the assessments come from the athletic trainers in terms of the work of all of the assessments, I should say, working through the protocol. And I will get involved if the athletic trainer or a family member or coach, if they start to notice deviations from baseline. And so that's when usually I get involved in the piece.
Okay.
The puzzle.
Thanks.
Thank you again, everyone, for attending and for the speakers for being here. Again, just a reminder, this will be on the BroncoFit website at that link shown. And if you have any questions, feel free to email wellness@Boise State. Yeah, thank you again for attending, and that wraps up our concussion seminar.
Thanks, Hannah and Isabella.
Thank you.
Bye-bye.